Rheumatic endocarditis, inflammation of endocardium, result from rheumatic fever caused by type of bacteria called group A streptococcal infection or bacteria. The manifestation tiny مثل رأس الدبوس, translucent growth, pin head size, pits of the valve flaps with serious dysrhythmias, pneumonia, التهاب ذات الرئة, valvular deformities, murmurs, thrills, and palpitation. Management: eradicate organism, remove the microorganism that cause the infection by using the appropriate antibiotics and prevent complications. The appropriate antibiotic could be penicillin as the drug of choice, and long-term therapy could be used. And we have to treat the complications. We have to teach the patient about the disease and the prevention treatment, and instruct and teach patient about long-term therapy, instruct patient for prophylactic therapy العلاج الوقائي. Pericarditis, inflammation of pericardium or pericardial membrane, التهاب غشاء التامور, associated with the chest pain, which is the most common symptom, over the pericardium, the clavicle, neck, scapula. This pain worsens with deep inspiration and with lying down or turning, and the pain could be decreased or relieved when the patient sitting on sitting position or leaning forward. إذا الألم يحدث خلال الديب inspiration أو خلال الاستلقاء على الظهر. يقل الألم في sitting position وفي leaning forward. Friction rub, it's the most characteristic sign بالphysical exam during the auscultation. Dyspnea, low cardiac output, increased white blood cell, the patient appears extremely ill. Diagnosis through the sign and symptom, physical exam, echocardiogram, and the CT scan. الصورة الطبقية اللي هي computed tomography scan. The infection leads to the accumulation of the fluid in pericardial sac and lead to the pericardial effusion and ultimately cardiac tamponade. Cardiac tamponade is an emergency condition in which a large amount of fluid accumulates over the heart, preventing the heart from its pumping activity, leading to decrease in cardiac output and may lead to cardiac arrest. So that this needs an emergency management to remove this fluid in order to preserve the cardiac function and cardiac output. Management: determine and treat the cause. Good rest, analgesic, non-steroidal anti-inflammatory drugs, corticosteroid, and prevent pericardial effusion. The patient should use the medication as prescribed. Gradual increase in the activity unless fever, pain, and friction rub reappear.